and we are absolutely delighted that after a rigorous and competitive process, the Wolfson Centre was awarded to Wales and is hosted in our department. I'm also a co-investigator on the exciting scientific programme of the Centre, which you're going to hear more about today. But perhaps more importantly, I'm also the parent of 3 teenagers. And I've seen at close hand the challenges that they and their friends have faced in terms of their mental health. And I'm particularly aware of how these challenges have been exacerbated in the face of the recent pandemic, of lockdowns, anxiety, and isolation. I've also seen how wonderfully resilient young people can be and how they can recover if they're given the right support. So I really think there's absolutely no more apposite time to be launching this centre. And I'd like to thank the Wolfson Foundation for their far-sightedness in establishing such a centre at this particular time. In normal times, we'd have liked to have welcomed you all to Wales and to Cardiff and to the centre and to have gathered together. But of course, these aren't normal times, not quite yet. And we're pleased that the power of technology nevertheless enables us to gather together online and be joined by people from around the world. And I hope very much that you enjoy the programme that's been put together this afternoon. Thank you all very much for attending. I'd also like to say a big thanks to our communications team, to Bex and Kat, who've put together the logistics of this tricky event online. And I'm going to hand over to them now just to give you a flavour for some of the ways that you'll be able to interact during the meeting, and then we'll carry on with the main programme. But thank you again. Thanks both to the Wolfson Foundation and to you all for joining, and I hope you enjoy the afternoon very much. Over to you, Bex.
Thanks, Jeremy. Good afternoon, everybody. As Jeremy said, my name's Bex, and I'm the Communications Officer for the Wolfson Centre for Young People's Mental Health. So before we start today, I'm going to share my screen and put to our audience some questions using the interactive tool Mentimeter. So if you haven't used Mentimeter before, it's a really useful way for us to gauge who we've got in the audience with us this afternoon and where in the world you're joining us from. So I'm going to ask if everybody could please go to menti.com and enter the code that's now at the top of the screen. The link and the code will be appearing in the webinar chat in a moment. And this is, as I said, this is just a really useful way for us to see who's joining us online today. The Menti tends to work best if you're using it on a separate screen to the one that you're viewing the webinar on. So ideally with a smartphone or a tablet works really well. So I'll just give everybody a few moments to get there. I can see there's a few people joining us. And then we'll get underway with my first 2 questions to you this afternoon. Okay, I think there's a good number of people getting this. So I'll make a start. So meet the Wolfson Centre, Croeso, welcome to you all. So my first question to our audience today is, where are you joining us from today? Are you in Wales, England, Scotland, Northern Ireland, or perhaps further afield? Oh, fantastic, we've got some answers coming in already. Lovely. Oh, great, it seems like a real mixture. Lots of people in our Welsh contingent this afternoon. Oh, that's great. Oh, and someone from Canada as well. Wow, welcome to everybody. Okay, thanks everyone. That's really, really helpful. Oh, a few more, and Scotland as well. Lovely, thank you all very much. So I'll move on to my second question, which is, how would you describe your primary role in relation to young people's mental health? Are you a parent, carer, researcher, practitioner, an expert by lived experience, or maybe you just have a general interest in youth mental health research. Researchers. Oh, that's great. Thanks, everybody. It seems like, again, we've got a real mixture in our audience this afternoon. So researchers, parents, experts by experience, practitioners. That's fantastic. Thank you all very much for entering in your answers here. That's really, really helpful. Thank you. So I will stop sharing my screen now, and I'll be back again at the end for another 2 questions to finish off the webinar. So, but for now, I'd like to introduce the next segment of today's event, which is an animation called Hello Wolfson Centre, which will hopefully give everybody a little bit more of an idea of what we're about here at the Wolfson Centre for Young People's Mental Health. Thank you.
The global pandemic has had a substantial impact on young people in the UK, with research showing that 1 in 6 are currently living with mental health problems. These problems cause distress to young people and their families, interfere with young people's success in school and the quality of their friendships, impact on physical health, and in the most serious cases, can tragically lead to loss of life through suicide. But what can we do to prevent mental health problems from developing in the first place? And what are the most effective ways of treating these problems when they do arise so young people can recover and flourish? We are the Wolfson Centre for Young People's Mental Health, a research facility established in 2020 based in Cardiff University that specialises in leading research on young people's mental health. Substantial investment from the Wolfson Foundation means we can realise our vision of ensuring a step change in scientific discovery around mental health that will crucially provide rapid benefits for young people's well-being through the implementation of effective intervention and policy. Our work could not be more timely and builds on the outstanding research and policy innovations that are being made around mental health in Wales. The Centre will bring together a diverse group of world-leading experts to work on discovering the causes of mental health and to help shape public health and school policies to promote better mental health in young people. Our researchers from Cardiff and Swansea University will work in partnership with international academia, schools throughout Wales, the NHS, the Welsh Government, and of course, young people themselves. Putting those people at the heart of our research is integral, and they will be involved in every stage of our work. Over the next 5 years, our work will focus on 5 main research aims. Studying children and young people as they grow to understand how depression emerges and develops over time. Identifying the key risk and protective factors for depression and anxiety. Developing new interventions to support families suffering from depression. Understanding the role schools can play in protecting young people's mental health, promoting resilience, and using health data uniquely available for patients across Wales to understand the long-term outcomes of young people experiencing anxiety and depression. Our ambition is to become a catalyst for change, for our scientific discoveries to rapidly inform policy and practice, to train a new generation of researchers and practitioners in young people's mental health, and to have a positive and lasting impact on young people's mental health for years to come. For more information, please visit cardiff.ac.uk or search for Wolfson Centre for Young People's Mental Health.
So, a brilliant animation and a great start to the afternoon. And let's really hope that this centre can achieve that mission. So I'd now like to introduce the co-directors of the centre. Delighted to introduce them, Professor Fran Rice and Professor Stephan Collishaw, who are going to talk some more about the aims and objectives of the work in the Wolfson Centre. So over to you, Stephan and Fran.
Thank you, Jeremy, for those kind words of introduction. Collishaw and welcome. I want to begin by saying thank you, and particularly to the Wolfson Foundation for their ambition and foresight in providing investment for a dedicated research centre focused on young people's mental health. I believe that such a centre is sorely needed, and really addressing and improving young people's mental health is one of the big societal challenges of our time. I want to say thank you to the Foundation for placing their trust in us here in Wales, not just the scientific teams who will be leading on particular bits of our research, but also in our partners with whom we will work together to make sure that that research can lead to meaningful change for young people's mental health. I would also like to thank Welsh Government and our partners in the NHS, with whom we have long-standing tradition of working together, but who are providing key investment as well into the centre through 3 joint funded posts, policy research liaison, as well as 2 new senior clinical academic appointments. Thank you also to a number of many supporters who've supported the centre from the outset. You will hear from some of them today, and also to the many people locally who have helped us in setting up the centre and putting on today's event. So to begin, I want to talk about the scale of the challenge that we face. In many ways, what we now see is a crisis, I think, in youth mental health. Children and young people's mental health problems are common, and they're distressing, and they're associated for many young people with long-lasting impacts on their lives. Mental health problems in young people also impact on family, on friends, on communities. And recent years, even prior to COVID, has seen substantial increases in the prevalence of mental health problems, including a 50% increase in rates of depression and anxiety. Too many young people still lack effective mental health support. And COVID-19 has likely exacerbated all these trends. Young people talk about the challenges that they're facing at the moment in terms of social isolation, worries about their education, worries about the future, and epidemiological evidence suggests that up to 1 in 6 young people are experiencing difficulties with their mental health. So how do we address these challenges? Our centre aims to do so by bringing an evidence-based approach to improving young people's mental health. Our aspiration is to deliver high-quality scientific research and to use a cross-disciplinary approach, bringing together experts from psychology, from psychiatry, from social sciences, from public health, data science, genetics, and so forth, to ask some really fundamental questions. How do depression and anxiety develop in the first place? What are likely causal and modifiable risk and protective factors? Developing and evaluating new interventions to improve the mental health of young people, and crucially also to track long-term outcomes. To do so, we have adopted a partnership approach right from the outset, working with young people themselves, partner policy experts, mental health practitioners, schools, and the third sector. The 4th key strategic goal for us is to ensure that we leave a lasting legacy in terms of a sustainable future of high quality youth mental health science and evidence-based practice and policy. And to do so, the key priority for us then is to train, to develop, and to empower the next generation of mental health scientists and practitioners. You've already heard about some of our key research themes, and Fran will talk in a bit more detail about how these might come together to answer some of these key general questions. I want to talk a little bit about the types of research approaches and research that we can bring to bear to answer these questions. These include longitudinal population cohorts, children and young people studied from early in life through childhood, adolescence, and into adulthood, innovative genetic designs that have the power to illuminate our understanding of environment. A novel family-based intervention building on long-standing research here in Cardiff, including one of the longest running and largest studies of children of depressed parents. And in Wales, what I see is really quite a unique research infrastructure, bringing together all mainstream secondary schools and every patient in Wales. So finally, before I hand over to Fran to continue this talk, I want to talk about 3 key advisory boards who will be guiding us in our research. We have an implementation and engagement board, bringing around the same table experts in policy, mental health practice, education, and young people themselves, meeting quarterly to really advise us on how our research can make the most difference. Last week, I had the privilege of meeting for the first time our 2 new youth advisory groups, and it really was inspirational to hear from them about their experiences of mental health. And then next month, we will have the first meeting of our International Scientific Advisory Board, and you will hear from some of the members of that board here today. So with that, thank you very much again, and I will hand on to Fran.
Hello, I'll talk some more about the research that we have planned and that we're undertaking currently. So most of our research really focuses on prevention and on early intervention. And the reason that we do that is that as many as 3/4 of young people who would meet criteria for an anxiety disorder or a depressive disorder go undetected and don't seek help and don't receive intervention. And that's despite quite good evidence to suggest that early intervention would be likely to reap long-term beneficial effects. And so in much of our research, we really focus on this unrecognised majority of young people affected by anxiety and depression, though we do consider the full spectrum of mental health. And so what we aim to do, as Stephan's mentioned, is really try and focus on answering scientific questions that can have a practical benefit for young people. And so we do this by working together collaboratively across our respective research themes. And I've taken 3 examples today really to try and give you a flavour, I suppose, of the scale and the scope of the type of work we are undertaking and have planned. And so one of the first questions is, how do we understand the different adult outcomes that young people who experience anxiety and depression as teenagers show? And so we know that many young people who experience anxiety and depression unfortunately continue to experience similar types of difficulties in adult life. Happily, some young people recover and function well in adult life. And then for a much smaller group of young people, these difficulties seem to be the beginnings of a different type of condition that may onset later. And this is a much rarer outcome, but may be something like bipolar disorder. And it's very difficult for young people and for clinicians to really be able to understand the different outcomes for young people who experience these difficulties. And so we aim to make use of really large scale, detailed data sets from populations, from young people with clinical diagnoses to ask and identify some of the social, clinical and genetic characteristics that can help explain this variability in outcome that we see for young people. A second focus really is on a particular group of young people, and this is the adolescent children of depressed parents. And the reason we focus on this particular group is we know that depression in parents is very common, and we also know that it increases the chances that their children may experience mental health difficulties, though that is by no means a deterministic risk, it's just a likelihood. But we also know that this group represent a major lost opportunity for intervention. And that's because when these young people do experience signs and symptoms of depression themselves, they often don't seek help. And that's despite the fact that their parents are typically known to health services. So potentially this group could be identified and offered early preventive intervention. And so we aim to test an intergenerational approach to see if that can reduce the likelihood of young people developing depression themselves, but also to use this information to just much better understand what the mechanisms underlying the transmission of depression within families are. So our own and others' research, for instance, suggests that this is much more about environmental rather than inherited processes. And then a final sort of example question really is around how do we promote resilience? So we aim to do this in 3 ways. The first focuses on the school environment and asks, can we develop, evaluate and adapt existing interventions to optimize the school environment to sort of protect and enhance mental health for all young people at school? And then equally, can we develop evidence-based approaches and resources to support early access to good quality evidence-based information and intervention for young people who are seeking help for and experiencing mental health difficulties at school? A second part of this work involves using really robust research designs to get at the causes of anxiety and depression so that these can be fed into public policy around enhancing exposure to protective factors and reducing exposure to risks. And then a final sort of part of this puzzle, if you like, is around understanding what some of the key social drivers are for the increases that we've been seeing in emotional problems in young people over time. As a centre, we have a real focus on providing and embedding interdisciplinary training in all that we do. And that is to equip the next generation of mental health scientists and practitioners and leaders with the skills that they need to undertake this work. But it's also about ensuring that our research is as rigorous and as high quality as it can be. We have a number of forthcoming events and opportunities that people can get involved in. And I particularly wanted to highlight our PhD training scheme, which will be advertised later this month, and also our invited talks from experts in clinical and practitioner terms, where we're going to make these available on our website for our colleagues and partners working in other fields. So with that, I would just like to thank you again for coming, and we hope that you enjoy the afternoon. Diolch. And it's my great pleasure to be able to pass over next to Lynne Neagle, Member of Senedd, who is Deputy Minister for Mental Health and Wellbeing. And we're delighted that you can be here with us today. Thank you.
Thank you very much, Frances, and thank you for that warm welcome and for inviting me to your virtual event today, which marks the year anniversary of your centre opening. It is a genuine privilege to be able to join you this afternoon. And as your animation acknowledges, the centre opened at a very turbulent time for all of us in Wales and indeed around the world. And there can be little doubt that the coronavirus and its wider effects, the necessary restrictions, etc., have impacted very significantly on the lives of children and young people. Being away from school, clubs, family and friends has been very challenging for many children and young people. So in this sense, the development of this centre over the past year is incredibly timely. And I'd like to say how important the work of the Wolfson Centre is to the Welsh Government and how much I personally value the work that you're doing. Your work to conduct robust, independent, high quality research will help inform our policy for youth mental health, anxiety and depression over the coming years. I know that the centre is eager to break down barriers between research, policy and practice in order to improve outcomes for children and young people. This is an approach I'm sure all of you here today very much welcome, and I'm really pleased that the Welsh Government was able to provide funding to the centre to employ a linked Wolfson and Welsh Government research officer who is working closely with us in order to translate research into delivery. As the research conducted by Wolfson highlights, some children are particularly vulnerable to having mental health issues due to their early environment and circumstances, situations which are beyond their control as children, but which unfortunately can play an instrumental role in shaping their mental health and determining their life path as adults. This is reflected in the Centre's research, which demonstrates that the majority of children with mental health problems continue to have mental health problems in adult life. This is why a focus on early intervention is so crucial and absolutely fundamental to prevent mental health problems from escalating. And what I've heard so far today has been music to my ears, because I don't think spiraling mental health problems are inevitable, and the work that you are doing is absolutely key to stemming the rise in young people's mental health problems. Our programme for government over the next 5 years has a specific commitment to prioritise service redesign to improve prevention, tackle stigma and promote a no wrong door approach to mental health support. As we've heard already, the Wolfson research refers to the benefits of having a whole school approach as a means to reach out to young people with mental health problems. Delivering a whole school approach in Wales is absolutely central to our efforts to build resilience and intervene early with children and young people. Welsh Government has made available a total of 9 million in the current year to support our whole school approach to learner wellbeing. This represents a significant increased investment over the last 3 years, demonstrating our commitment to this area. And I very much look forward to receiving the research findings from the Wolfson Centre regarding the difference this is making to our children and young people in Wales. Now, I'm very conscious of the time, however, I would like to acknowledge that as the Wolfson research highlights, there are cases where a small number of young people in Wales continue to require inpatient CAMHS provision. Continuity of mental health support at the community level is of course equally important, and taken together we've made available a further 5.4 million in this financial year to support young people with diagnosed mental health conditions through community or specialist inpatient services. Having regard to the treatment gap referenced in the Wolfson research, I'd also like to reassure you that we continue to invest to improve child and adolescent mental health services and to develop appropriate provision for our young people. As I'm sure you appreciate, the funding provided to mental health services is only part of the picture and must be seen in the context that a cross-government and multi-agency approach is crucial to stem the expected increase in mental health needs. And the challenge for me as Minister is to ensure that we achieve that cross-government preventative approach at the same time as meeting the needs of today's children and young people. Finally, in closing, I'd like to commend the emphasis the Centre places on ensuring that the voices of our young people are fully captured through your Young Persons Advisory Group. And I'm really looking forward to the In Conversation with Young People video that we're going to hear later on today. Placing the experiences and voices of young people with lived mental health experience at the heart of the Centre's work is of utmost importance. And Welsh Government looks forward to working closely with both the Centre and its Youth Advisory Group as part of a collaborative approach. I too, as a Minister, in addition to the formal routes of listening to the voices of children and young people, will continue to put the voices of children and young people at the very centre of what I do. I'd like to thank you for listening and wish the Wolfson Centre the very best of success over the next few years. There is nothing more important to me than the emotional and mental health of children and young people. And it is incredibly valuable to know that you're here and to be able to receive your research in order to inform policy and delivery in a practical way, making a meaningful difference to our children and young people in Wales. So thank you for inviting me, and I'm very much looking forward to working with you in the years ahead. Diolch yn fawr.
Diolch, and many thanks, Lynne. It's great to have the Welsh Government appreciating the importance of mental health, as you've so clearly outlined, and to have this growing an opportunity to link together research and policy development, which is really fantastic. It's also great to have a minister who's obviously clearly attuned to these issues and takes them seriously. So thank you very much for that. Our next video, as you trailed, Lynne, is excitingly from two of our Wolfson Centre youth advisors in conversation about the important mental health issues for young people today. So I'm going to hand over to Bex, who's master of the technology, and hopefully we'll get this video. But thank you again, Lynne. Thank you for your support.
So I am, I guess, the youth representative, or one of the youth representatives on the Implementation Engagement Board for the Wolfson Centre. But I've been working as a mental health campaigner for 8 years, mainly working kind of in the topic of youth mental health, but kind of more recently working more towards youth mental health altogether, of all ages. I also do a lot of work around nature and mental health and biology, marine biology. That's what I'm studying, marine biology at the moment. So I'm kind of crossing over the two quite often.
So I'm George. I'm also a member, one of the youth representatives on the Implementation and Engagement Board for the Wolfson Centre. And also, like Maya, I've been a mental health campaigner for about 7 or 8 years now, but particularly focusing on more sort of male-orientated mental health. So looking at bigger issues like stigma and male suicide and that kind of thing.
I think for me, it's a sense of not feeling safe, whether that be both physically unsafe or just unsafe within yourself, that you're not feeling like you can be who you want to be, or being that person doesn't feel right at that time, and not being able to feel comfortable where you are mentally or emotionally or psychologically. And I think that lack of safety or sense of safety then has a profound impact or knock-on effect on how you care for yourself and how you interact with the world around you.
I think that the word safe is really interesting there, and that's not something that I've considered before, but I think that is probably a really good description of it. And I think I have a funny, well, not really funny, a running joke with my housemate that you can usually tell where my mental health's at by the state of my bedroom floor. So if it's covered in clothes or, you know, bits and pieces just left around the place, you can usually tell that I'm not checking in with myself well enough, or I'm feeling a bit distant, or sort of I'm having issues with whatever it is, with anxiety or being in a bit of a low place. And I think that feeds more widely into care. And I think care is something that I've clocked is something that can often be the first thing to slip. Even the smallest things, whether it's, you know, in my case, tidying up after yourself, or, you know, not focusing as much on, you know, things like eating well or socializing or like your sleep and that kind of thing. And it's almost like an ecosystem. And if one thing is out of balance, it can lead to a bit of a spiral. But it also, because it is just one thing, quite often making small adjustments can make a huge positive difference.
As a lifelong science lover and scientist in training, science is and research is the first step in changing something. We have to have good quality, reliable, repeatable evidence and results to show us what is the correct way of understanding something. And once we have the correct way of understanding something, we are then able to take that to policymakers, to change makers, and show, well, to change the way we live our lives or change the society we live in. I think research is the first step in bringing equality to society. If we are able to research both the socioeconomic factors and the biological factors that go into mental health, particularly young people's mental health, then we can start to look towards a future that is equitable and that in a place, in a kind of society that promotes mental health and encourages and helps children and young people to develop healthy senses of selves and self-worth and contentment.
Yeah, the only thing I think I'd add to that is I'd focus on the outcomes as well. And I think my worry, not being from a science background, would be translating that research into clear solutions that we can bring to the table, whether it's ways of advancing, therapy, or ways of advancing, say, medical research and, medical interventions, that kind of thing, or whether it is just as simple as, the benefits of say, breathing techniques or different breathing techniques on calming anxiety. I'd be really keen for the research to pull away from, not away, but at the end of it all, it's the young people that have to be the priority with this. And I think the research has to be something that we can see change their lives. And I don't want the research to just remain research. I want it to be, practical solutions as well. I think in terms of, on the communication side, probably the best way to do it is to just try and answer the question, or even pose the question to them: why do you think that this work matters? And I think it's a very simple question, but it's a lot trickier than that. And I think you'll get the best response and the most engaged response if rather than, you're saying this is what you should think, and this is what we're trying to do. Why would this work impact your lives, and how can this work be life-changing?
Young people are having to learn to be in that professional environment. If you're bringing young people into those environments, young people having to learn how to be in that environment. But equally, the researchers and scientists who may be 20 plus years older than the young people are having to learn how to cater to those young people and change the way that they communicate so that the young people can understand. And the way that you can do that effectively is actually just to be honest and say, look, how can I best support you whilst we both learn how to be in this room together? Should not be expecting the young people to learn how to speak like an academic. You need to ensure that the academics are comfortable with the young people in the room, and that young people are comfortable with the academics in the room, and other professionals. And I think, as I just said, being honest and saying, look, we're learning about this together. We'll probably hit some roadblocks. Let's work this out together, and we'll figure out how we best communicate with each other, and how can we best get the most of each other's knowledge and experience into this work that we're doing.
Well, the most simple thing, sorry to start with first, is that it exists, which I think, you know, it sounds like a joke, or it sounds insignificant, but I think the fact that it's being taken seriously as an individual subject of research, I think, is extremely, extremely important in terms of what it signifies. I think it shows a real landmark in terms of where we're at, particularly with stigma and general social attitudes towards mental health, which are, you know, I first started to struggle with my mental health when I was about 13, 14, and it was a completely different landscape than it is now. And I think it's excellent, and it's also new. I'm not aware of anything else that's vaguely similar, and I feel privileged to have it on my doorstep, I think. Yeah. What about you, Mo?
Yeah, I would agree with you that it's an indicator of a more kind of larger societal change in attitude in a way, and it is a privilege to have it, well, in Wales as a Welsh person. I think this is slightly different because it's being set up from the very beginning as something that is collaborative with the population of people that the research is focused on. So in this case, young people. It's not starting halfway, you know, it's not been set up 50 years and now they're starting. I think that we have a unique opportunity with the Wolfson Centre to get the policies, to get the behind the scenes groundwork done right, which will enable access, enable inclusion, and enable equality between those who are experts by experience and those who are experts by training. And I find that really exciting as well. So I look forward to seeing both the science and the engagement and cooperation.
Brilliant. Yes, thank you, Lynne, for clapping. And I think we'd all like to thank Mayor and George for their excellent contribution there, and really just emphasizing how critical the process is, how important it is to, as George said, to get proper pull through on the other side. I completely echo that. And how important it is for the Wolfson Centre to have direct involvement from young people in the research and the research outcomes. So thank you very much for that. We now move on. We have a recorded message from the Wolfson Foundation, who are, of course, our sponsors, and without whom this whole enterprise would not be going forward in the way it is. So we're very grateful to them and look forward very much to hearing their message. So Bex, over to you, please.
Well, it's a great delight to speak today on behalf of the Wolfson Foundation on this auspicious occasion. My mind goes back to 2019 when we launched our mental health initiative. And we launched it really for two reasons. First, we were aware that this whole area of mental health research, particularly mental health research into young people, was underfunded in the UK and had been for a long time. And then secondly, we were also conscious that the rising tide of depression and anxiety was taking a huge toll on young people across the UK and beyond, and indeed having a significant impact on society in a number of different ways. So we pulled together an eminent committee of international researchers chaired by Professor Trevor Young of Toronto University. And we set them the task of identifying one centre that would receive investment from the Wolfson Foundation in this area of youth mental health. So we received many outstanding proposals from different corners of the UK. some very impressive. But the application that came from Cardiff stood out above all others, and indeed it was the unanimous recommendation of the expert committee that the full funding be allocated to this centre in Cardiff. And I suppose the striking features of the proposal and the things that makes this centre such a compelling place were as follows. I mean, first, the sheer quality of the research to be undertaken. And alongside that quality, the breadth of what's going on, a breadth that spans all the way from genetics on the one hand to epidemiology on the other. But that research strength, I think, is particularly well placed here in Wales. The researchers clearly have this remarkable ability to forge collaborations and partnerships with other researchers here in Wales, but also collaborations internationally with some of the leading players in the field. We were also really impressed with the way in which collaborations are taking place with the health service and with the schools network across the whole of Wales, and perhaps most crucially of all, with young people themselves, who clearly are front and centre in terms of this research. One thing that the expert panel really commented on, and which I think is genuinely unique in Wales, is the access that researchers have to a very rich data set that spans health, social care and education, and which provides a real baseline, a real basis for the high quality research that will be taking place. So for all of those reasons, and also because of our long track record of involvement with and partnership with Cardiff University, we were thrilled to make the announcement of the investment of £10 million into this initiative. It's been great to follow developments since. It's very exciting to be speaking on this occasion, and we're looking forward over the next few years to seeing how the research develops and to hearing some of the fruit that comes from that research. And what a wonderful thing it will be if some of the outcomes can have a really profound impact on shifting the dial in society, in helping young people who are struggling with mental health. And so we wish you well and look forward to hearing the outcome of that research.
So that's great. Many thanks again to the Wolfson Foundation for their vision and support, and for that lovely message from Paul. As Paul mentioned, collaborations are central to the way the Wolfson Centre works and will work. And we're delighted now to be able to hear some messages from our various international collaborators. So over to you again, Bex.
Greetings from Boston. My name is Vikram Patel. I'm the Pershing Square Professor for Global Health at Harvard Medical School and a psychiatrist and global mental health practitioner. Congratulations on the launch of the Wolfson Centre for Young People's Mental Health. And I'm absolutely delighted to serve on your scientific advisory board. I hope to bring years of experience of working with young people in very diverse contexts in India and now in the US, and also in collaboration with colleagues in many other countries, for example, Uganda, to the centre's work. In particular, I hope to bring these experiences, these values, and these principles to the centre's own goals. For example, to look beyond narrowly defined mental illness, embracing a diversity of mental health experiences and approaches that are tailored both to the needs of the individual and specific vulnerable groups of individuals. To meet young people where they are, for example, in educational institutions. To prevent mental health problems by targeting harmful environments across the early life course, both in childhood as well as in adolescence. To embrace a career pathway that focuses on the base of the pyramid, that focuses on early interventions from supportive care for psychological distress to low-intensity psychosocial interventions for more enduring mental health problems delivered by frontline workers. and most importantly, to have youth always at the center of all decisions by identifying what matters most for health programs, to how they should be delivered, to how they should be held accountable. Thank you so much for inviting me, and all the very best for your exciting journey.
My name is David Brent, and I'm a child psychiatrist at the University of Pittsburgh and on the scientific board of the Wolfson Centre. I would like to welcome you to this center, which holds great promise in being able to make progress on the prevention and understanding the causes of adolescent depression. The team is among the best in the world and is taking a multi-pronged approach to understanding both differences in the outcome and trying to develop preventive interventions in schools and families to decrease the burden of this problem. The center works in close partnership with individuals with lived experience with depression, practitioners, and policymakers, so that the scientific advances that are almost certainly likely to come out of this center will be translated into actionable public policy.
Hello, my name is Dr. Liebenluft. I'm a psychiatrist and I work at the National Institute of Mental Health in the United States. There, I do research with children who have very severe irritability. These are children who have difficulty with lots of temper outbursts. They lose their temper a lot, they get very angry, and unfortunately, they're kind of grumpy and grouchy a lot of the time. And you can imagine how this really impacts in a negative way on their lives and on the lives of their families. I've worked with a number of the folks from the Wolfson Centre over the years, and I'm really excited about being able to collaborate with them again. Children's mental health is just so important because so many children have psychiatric difficulties, and it really not only impacts on them and on their families in the here and now, but of course, it also impacts on these children as they continue to grow up and develop. And it's really important for us to figure out what we can do to help these children so that they can do better in the here and now, but also so that they'll be able to have happier, healthier, more fulfilling lives as they grow older. We don't want them to be hampered from the very beginning. I'm particularly interested in working with the folks at the Wolfson Centre because they're amongst the most talented people in the world working on these issues. And I really appreciate the very broad-based approach that they take to this problem. They integrate material and information across a number of fields. And bring it all together in multidisciplinary teams, folks who have different kinds of training working together. And I think that's really important because children's mental health problems are very complicated and they need to, and for us to solve them, we need to involve people from a number of different areas of training with lots of different expertise. And the Wolfson Centre does that. And then finally, I really appreciate how the Wolfson Centre focuses on pragmatic solutions. How can we figure out some ways to help these children soon and help lots of children? How can we disseminate what we learn to a broad number of children, like through schools and other means? So I'm really, really pleased to be invited to speak here and be part of this event and of the Wolfson Centre and all the wonderful work that they're doing. Thanks.
Hello, my name is Dr. Daniel Pine, and I'm a child and adolescent psychiatrist at the National Institute of Mental Health in the United States. And I am thrilled to welcome you and to offer congratulations to the Wolfson Centre for Young People's Mental Health. My own research examines aspects of both depression in young people as well as anxiety. And there are very strong relationships between anxiety and depression. One of the keys to addressing the burden of adolescent depression might be doing a better job of both diagnosing and treating anxiety disorders. And I look forward to working with the Wolfson Centre to think about these and many other important areas of research. What I think excites me most about the Wolfson Centre is the idea that the center is dedicated to taking what we know from research and applying it in ways that impact the daily lives of young people. So the community is extremely fortunate to have such an opportunity, and I am very excited to work as a scientist, as a clinician, and as a parent to helping the outstanding leaders of the Wolfson Centre. Once again, congratulations.
Sutahi. Greetings to you all from New Zealand. My name is Sally Mary. I'm a child and adolescent psychiatrist and hold the position of the Cure Kids Duke Family Chair in Child and Adolescent Mental Health at the Auckland School of Medicine. It's very exciting to see the Wolfson Centre established and underway, and I'm delighted to play a very small part in celebrating the first year of its operation. It is particularly precious as my mother was born and grew up in Kevin Forest in the Valleys, and my father is from Swansea and went to Cardiff University. The work of the centre is particularly relevant today, with rates of increasing anxiety and depression in our young people and adults as well, but particularly with the pandemic and its multiple lockdowns and the looming spectre of climate change. Now more than ever, we need to find ways that we can support young people to be resolute and resilient. The many and interlinking facets of research underway, and with such a diverse team within the centre, provide a wonderful opportunity to reach a greater depth of understanding of mental health and to inform our future efforts to intervene helpfully. My own interest has been in the prevention and early and effective intervention in anxiety and depression, and particularly how we might use technology to allow for more widespread and equitable access to mental health interventions for young people. To this end, I've been particularly involved with the work of Dr. Stephan Jones with his lovely resource, Moodhub, which I think has the potential to make a big difference. I would love to be with you as you celebrate today, and I look forward to our coming out of our latest lockdown in Auckland, and to when the links between New Zealand and the rest of the world are re-established and I can come and visit. In the meantime, I wish you a wonderful day. Really chipau.
It's great to see the reach of not only the centre, but the reach of Wales across the globe there. So many thanks to Vikram, David, Ellen, Sally, and David and Daniel for their excellent contributions and their support to the centre. It's really fantastic to have such a great group of international collaborators. And as I said before, collaboration is at the heart of what's going on in the Wolfson Centre, and we welcome further such collaborations going forward. Thank you for your attention so far. We're going to have a short break now, but don't go far, because straight after the break, we will have a public lecture from Anita Thapar, which I'm sure will be absolutely fantastic, and I'm greatly looking forward to myself. So 5 minutes break, I believe, Bex, and then we'll be back on. Thank you for your attention so far. Okay, I didn't set an exact timer, but I think that was about 5 minutes. So hopefully everybody's back, feeling refreshed and ready to restart. What an excellent afternoon it's been already. And now we're delighted to have a public talk from Professor Anita Thapar, our distinguished colleague, on young person's mental health lessons from research. And I don't think there's anybody I can think of who would be better placed to give such a talk. So we're really looking forward to hearing it, Anita. Thank you very much.
Thank you, Jeremy, for the introduction, and thank you to all of you for coming to join us. We're very excited about the centre. Just a bit of background. This is I'm trying to aim this at everyone, so scientists, forgive me. My background is I've been a child and adolescent psychiatrist for over 30 years, and I'm also a scientist. So with that, I will share my slides.
And just to say, I think there will be an opportunity to place a few questions in the question and answer box for Anita. So we'll try and keep an eye across those as well. Over to you, Anita. That looks perfect.
Brilliant, you can all see it. Fantastic, that's a good start. Well, welcome everyone to the second half of this afternoon. I don't think anyone needs to be uncertain about are people taking children and young people's mental health seriously. It's everywhere across our news, and it is a really important topic. But I just want to start off by saying, well, actually, what do we mean by mental health? And I think, particularly as a psychiatrist, I'm really aware that this encompasses a huge spectrum. So on the one hand, we've got mental well-being, where young people are thriving, but then you can have a few symptoms, feeling a bit depressed or anxious, but you're coping. Then these can become more persistent, where people are struggling. And actually, if these carry on, people can become extremely distressed and where this is where we start calling things a disorder and where you start needing specialist help. So it is a whole spectrum, but sometimes people forget about this. We are really familiar with it for physical health. So we all accept that sometimes we have hiccups in our physical health, coughs or sniffles. Sometimes those will get really bad, and it might be difficult to go to work, and we might need to see someone about it. And other times people get really unwell and they need specialist treatments. So I think the best way of looking at mental health is as a spectrum. And as I said, sometimes people forget about this. The other thing is that there are many different types of mental health problems, and they tend to come in at slightly different ages. So neurodiversity, autism, ADHD, we call these neurodiversities rather than mental disorders. They tend to start very early. Then you've got anxiety, which comes in from childhood onwards, eating disorders through adolescence and depression, and bipolar disorder and schizophrenia that come on a little bit later. Now, so many of us tend to think of these in silos, really separate. You know, clinicians who say, right, well, I actually am an expert in ADHD or eating disorders, and our services are like that, and the research is like that. But one thing that we have learned from research is that there's rarely one type of problem. Anyone who's a practitioner will already know this, that actually when we see people, there's overlapping sets of problems. And actually we can't look at these as separate and in silos. Not only do they show overlaps between each other, but we've also learned that the predominant difficulty might change over time. So for example, somebody might have autism as a child and then as a teenager develop depression. And so one thing I really want to emphasize is that these overlaps are really important. So why is there so much more concern about young people's mental health? We've heard this from quite a few different people. Well, first of all, the research has shown that there are more young people with a mental health disorder than 20 years ago. The biggest increases, particularly in recent years, as Paul Ramsbottom said, anxiety, depression, and most recently, eating disorders. And for those of us who work in specialist CAMS, obviously this has been reflected in huge increases in referrals. And it's not just because of that. Also in the last 20 years, we've had changes in service configuration of going between up to 16 to up to 18. And 16 to 18 is a peak age of onset for many mental health problems. These are the latest UK-based data. It's from a mental health survey done across England, but the demographics will be quite similar for many parts, rest of the United Kingdom. So in blue, we have the rates in 2017, and in orange in 2021. So the age 11 to 16-year-olds, you can see that the rate has gone up just even in those years since after COVID, and age 17 to 19, also a huge increase in mental health problems. And this is probable mental disorder. So this is right at the other end of the spectrum. So apart from the increase in rates of mental health problems, there are other really important reasons to be concerned about young people's mental health. Apart from being hugely disruptive for the young person themselves, particularly if they're in school, for their families and everyone around them, it's also relevant to the whole of society, even if you don't know a young person or you don't, I mean, I've got 2 boys myself, but even if you don't have boys, because actually of all the mental health disorders across adulthood, nearly all of them have originated before the age of 25. So if we want to do something about mental health disorder across all ages, we need to focus on young people. And the earlier the onset, the worse the outcomes. So it really is important to begin early. So as I've mentioned, there are many different types of mental health problems and they're overlapping. Our centre will focus on anxiety and depression, but we will not look at this in isolation of all the other types of difficulties. But for the purpose of this talk, I'm going to focus on depression. So depression, like mental health problems, encompasses a really huge spectrum. We can refer to it as a mood state, and which of course is absolutely typical, normal. We all have fluctuations in mood, days when perhaps you feel a bit sad or worried, but actually you're coping. Then that you can have low mood, which comes with a cluster of other difficulties. Loss of interest, just for example, a young person who's no longer interested in going out with their friends, not enjoying, perhaps they had an interest in sport, no longer enjoying that, finding it difficult to concentrate, which of course is a huge problem in school, sleep, appetite, becoming distressed and other people may be getting concerned. And then if it stays persistent, that cluster of difficulties, and it interferes with daily life, we then start calling that a disorder, major depressive disorder, and all these are accompanied by multiple risks. So we do have to take it seriously. We've talked a lot about Wales, and of course we are based in Wales, but just to highlight that depression is actually a leading cause of global disability. And actually, just a word of reminder, because most young people are in low and middle income countries, most of the burden is there. But of course, we have it everywhere, including here in the UK and Wales. Depression is actually set to become the world's leading cause of disability. That's looking at all health problems by 2030. So it is actually a global issue. What have we learned about depression? We've learned it nearly first onsets in adolescence. It's more common in girls and women, but it's important to recognise because of that fact, it may be missed in males. And that's really quite important to remember. And across all countries, not just the UK, rates of major depressive disorder, that's the severe end, have risen in young people. So a really big question is, why has depression in young people increased over time and across countries? Everyone speculates about why that might be so, but you actually need really robust scientific approaches to do this. And this is going to be the work of Wolfson Workstream 1, led by Stephan Collishaw. So the next question is, if you really want to prevent depression, what causes it in the first place? Well, we know, we've learned in the last 20 years, it is never one risk factor. It's multiple risks that all add up together to create risk for depression. And these, of course, could be modified by the action of protective factors. People sometimes think, well, the social experiences have got nothing to do with brain, but actually, again, what research has shown is that risk factors such as being bullied, living in very stressful early environments result in brain changes. And what we see when we see people is that this can alter ways of thinking and alter people's behaviours, which then can lead to depression. There are multiple risk factors associated with depression, and I'm sure this isn't a full slide, you could get even more. We know there are some things which are specific to young people, so having somebody else in the family with a mental health problem or genetics. There'll be some which affect the individual, such as having a chronic long-term physical illness, being neurodiverse, having anxiety is also a risk for future depression. And then encountering very stressful circumstances like being bullied or getting involved with having a really problematic relationships or very stressful events. And we also know that the broader types of stressful situations, such as perhaps living in poverty, certain minority groups, we know, not all minority groups, but certain minority groups at increased rate. So what I've done is I've highlighted double asterisks where we've got good evidence, one asterisk where we've got reasonably good evidence, and there are some you can see there that aren't as robust. So there are so many different factors that go together with depression, but we don't necessarily know that these genuinely are causes. For example, some of these things may just arise because the person is depressed already. So if somebody's depressed, they may start not seeing people. But it's really important. Why is it important to identify genuine causes? Well, we all know that cigarette smoking can lead to lung cancer, and it can also lead to heart disease. Because we've learned that, we've really cut the rate of smoking in many countries, and the rates of heart disease have fallen in some places. However, if you get the wrong risk factor, you could be just wasting your time with prevention programs. So for example, vitamin E was thought to prevent heart attacks. That's now been shown not to be the case, so there's no point in taking it. So we need to do that for depression. We need to reduce harmful risk, increase protective factors. And it's also helpful looking at risk factors because particularly if you are working with young people, perhaps in schools, or you're a practitioner, being able to identify groups where you might feel a little bit more concerned about them. So a big question for the Wolfson Centre is actually identifying what causes depression in young people to inform prevention programmes. So work stream 1, led by Stephan, will be is using data from across the UK, which has tracked people from birth to adult life. And work stream 2, led by myself, you might not everyone might know this, but you can actually use genetic techniques to identify social and environmental causes. And that's what we'll be doing. So what could help the spectrum of depression? So if we go down to this left-hand side with low mood, having increased knowledge and awareness of depression in young people is important, and knowing what sorts of self-management skills would be helpful. For example, we know that sleep is important, engaging in pleasurable activities, and certain behaviours are harmful. What sorts of being able to harness support from people around the young person. We also know from research that actually improving the school emotional climate, so pupils have a bigger say in their schools and you've got warmer, more supportive relationships, also helps. So that's one place to start. If, however, you've got low mood with a cluster of many other difficulties, then it's important to recognise that this is becoming a problem. So you have to recognise, be able to provide early intervention, and ideally now prevent this from actually going on to disorder. And finally, for the really more persistent difficulties where there's an interference with day-to-day life, then we're thinking actually about intervention. So work stream 4 is actually all about that first left-hand side, detecting and recognising depression. We're going to develop an evidence-based toolkit for schools with our colleague who you saw earlier in New Zealand. Also a self-management web-based tool, which is being led by Rhys Bevan-Jones. And also our colleagues, this is work led by Simon Murphy and Graham Moore, will be evaluating what works in schools across Wales, because the data on all schools and pupils is there, by testing the effects of new policy changes, the whole school approach. So moving from the very earliest stages, what about early intervention and prevention of disorder? Well, the commonest risk factor is actually having a parent who's got a history of depression is estimated at least around 4 million children and young people are exposed. I just want to say that many, however, with a family history, or even if they're exposed to a risk factor, can show resilience. It's not inevitable. And some of the research from our group has actually shown what can enhance resilience. Risk isn't inevitably leading to difficulties. So what research has shown is that actually, I've shown this before, if a young person who's at risk of depression is given a psychological intervention which tackles their altered ways of thinking and altered behaviours, that can help prevent depression. But then research has also shown that that does not work so well if if his or her parent is currently depressed. So how can we help prevent depression in a high-risk group where 2 generations have depression? Well, we are going to be using a novel cross-generation approach. This is Wolfson Workstream 3, the intervention led by Fran Rice, which will involve a psychological prevention programme where there'll be intervention for parent and the young person and identifying exactly how it works. So let's move now to the far end, the right of the spectrum. What about depression that is a disorder? So here I'm talking about low mood, many other symptoms that persist and where young people are having problems in their daily functioning, maybe getting to school, engaging in the usual activities that they would do. And here you're thinking about intervention or treatment. So what are the current guidelines now? And I'm talking about the UK guidance, which comes from NICE, for treating major depressive disorder in young people. So one of the first things that we've learned from research is that some young people, particularly with milder depressive disorder, will get better spontaneously. So we don't need to rush in straight away. We need to ensure that the young person is safe, that they've got good support, and that any harmful risks are minimised or removed and protective factors are increased. But if depression is severe, persistent, there are risks, for example, self-harm, family history or other stresses, then you have to move to intervention rather than wait. So what interventions for adolescent major depressive disorder work? Now it's funny because I'm a psychiatrist, sometimes people will say to me, oh, nothing really much works. And that's a real problem because that is absolutely not correct. We have a lot that works. And actually for scientists who've looked at how well interventions work for mental health versus physical health conditions, they're pretty equal and some of them are better. So actually that's really important to realise that. And I think that's sometimes why, I mean, obviously it's wonderful that the Wolfson has funded this, that people think, well, it's maybe not worth funding because you can't do anything. That's absolutely not right. So the first line intervention that's recommended in the UK is psychological talking therapies. And they work very well for milder depression and they work very well for some people. Not for everyone, of course, if the social context is very difficult, that has to be addressed. These psychological therapies basically target your thinking, behaviour, and how you relate to others. And for those who are interested in what these interventions are called, here's a list of them. And any one of these can be used, but of course the practitioner will try and match what of these talking therapies may seem better matched to the individual and their family and social context. What about moderate to severe major depressive disorder? So this is much more severe, it's really persistent. So again, I just want to emphasize, we do not use medication on its own, at least that is not recommended. You choose a psychological intervention according to the age, that's what's recommended. And then for the very severe and where it's not responded enough to psychological intervention, you add in an antidepressant. Now we have had very few treatment trials for the under 18s, just generally. I mean, my colleagues in paediatrics will say the same, it's not just mental health. There's only one antidepressant medication which is approved for under 18s in the UK, that's fluoxetine. It has to be administered by a specialist and monitored carefully. And actually, if fluoxetine doesn't work, there are a couple of others recommended. but we don't actually have the research for that yet. I'm going to tell you a bit though about what happens in real life, because nobody is the same. And one of the things I wonder is, should we call depression the depressions? So if you think about it, depression is a bit like calling a bowl of fruit fruit. And I'm sure all of you will agree that a grape is nothing like a banana. There are commonalities, so it's obviously helpful to learn, but actually every type of depressive disorder is different. And that is really quite a challenge. Just to highlight, this is not peculiar to mental health. It's the same in physical health. So, for example, person 1 could have completely different types of depression symptoms from person 2, but they've both got a major depressive disorder. Person 1 might have ADHD or autism. Person 2 isn't, but has had long-standing anxiety. The other way that can differ is some people may start having depression right at the beginning of their teenage years. Others, as they're getting into sixth form or later. So there's huge variation, or even later on in their 20s or later still, there's variation of age of onset. Social contexts are hugely variable. And also, whether or not people have a family history is variable. So some people have a parent who's had depression or bipolar disorder. Other people, there's nothing at all in the family. Some people have had exposure to really a lot of adversity all through their life, and others is just come out of the blue. The other really complicating thing is somebody could have depression and another person have depression and they have completely different outcomes. So some people will just get better and that's it. They'll never get another episode of depression again. Others will get better, but then have another episode in maybe a couple of years' time. And yet others may develop a different sort of mental health problem in the future. So we've got hugely variable outcomes. The other thing for anyone who's known somebody or perhaps themselves had any sort of intervention is different things work for different people. And at the moment, it is trial and error to find out what works for each person. And that's very frustrating for the person involved and for the practitioner. So Wolfson stream work streams 2 and 5 is how can we make our management of major depressive disorder more personalised and trying to sort of make sense, if you like, of this bowl of fruit. And what we're going to try and do is identify different depression subgroups using huge data sets with genetics, clinical profiles, social data and outcomes. And this is where a global perspective is really helpful because we're fantastic. We are so lucky in Wales. We've got all these data in Wales by NHS and schools, but we'll also be working with colleagues who've got really large data sets in Norway, Sweden and Denmark. Also large data sets from the United States. And finally, is that scientists have put together quite a lot of data sets from all around the world, just to emphasize these are all anonymized. We don't know who any of the people are, but it does make us then able to work together to identify different depression subgroups and making it more personalized. So just to summarize, I've given you a very brief overview of mental health and depression. I hope that if you take one message away, mental health problems and depression span a spectrum of severity. And I think that's really important because sometimes we say, oh, well, if we do this, we won't need CAMS, or actually, if we have CAMS, we don't need to worry about schools. We need it across the spectrum. They do span a spectrum and we need to look at the whole spectrum. It's complicated and we're going to need many different approaches. It isn't going to be a single approach. Policy changes, prevention, early intervention, and more tailored treatments. The really common pitfall is to think, oh my gosh, adolescent mental health problems, the rate has gone up. We're only going to focus on adolescents. But hey, adolescents are children before they become adolescents and young children. And actually what research has shown is that you've got to look across development and the earlier, the better. The other thing is adolescents, young people are not living in isolation. The top right-hand corner, some of you may recognize this. They live in systems, in families, in schools, in communities. There may be cultural contexts. Not only that, as I've already highlighted, we've got huge overlaps between the different types of mental health problem. Because of the prevalence, the increase in it, mental health of young people really needs to be a priority for everyone, not just researchers, but for those who are offenders, for those working with young people. It needs to be for us as a society. It cannot be one person highlighting this. And I think one of the young people mentioned this, which I think is really important. It's very tempting to think, oh, mental health is straightforward because, you know, everyone has a few mental health symptoms and we know what has to be done. But our most important thing is not to cause harm. What we do needs to be informed by research, and central to all of this has got to be the voice of young people. And with that, I thank you for your attention. Diolch yn fawr.
Thank you very much, Anita, for a fantastic presentation. Very, very clear, and but yeah, presenting a scientific perspective as well. So really, really enjoyed it. We've got a few questions coming in. I'm going to start off. It's a kind of prerogative to get to ask one. So I'm going to ask you, in talking about interventions and interventions that kind of work and can really practically help young people in this group, where do you think the role of kind of encouraging activity and exercise and kind of what might be known as behavioral activation, where does that lie in this spectrum?
Who wants to answer?
I was asking you, Anita.
Oh, me? All right. Okay. I didn't want to hog it. No, that's really important. I mean, there is quite a lot of research now on the protective effects of exercise on depression. So definitely, I mean, you might have noticed on my slides, lifestyle is one of them. So that's one of the first things I would say to somebody in clinic is actually think, what about your sleep? What about your exercise? What about your regularity of meals? What about your sort of basic timetabling and lifestyle factors? So that is really important. In terms of behavioural activation, of course, that's one of the psychological interventions. And yeah, I mean, there is a trial in the UK at the moment looking to see how it works. But actually, because it's quite a straightforward one to do. I'm aware there's been a few trials in low and middle income countries where it's actually been delivered by digitally, of course, with support from a specialist, but where they haven't had lots of resources in that context, then behavioural activation can work. So it can work in a behavioural sense of lifestyle and general advice to an actual therapy for those with depression. I hope that answers the question.
Brilliant. Well, we've got some questions coming in, and I'll let you, between you, Fran and Stephan and Anita, decide who best to answer these. But one here is, given the challenges that we've all discussed today of poor mental health amongst children and young people and service provision, how do you see, what would you like to see as the impact of the centre for future generations?
Shall I have a go and then?
It's a challenging question. It's a big question. I'm sure you'll do
it. It's a very challenging question. I think, to some extent, I feel like Anita's summing up slide did answer this. I think key things are involving young people at the heart of this, speaking to young people and seeing what their suggestions are. I think also key things are using scientific, really rigorous, high quality research, but breaking down barriers between partners, so people who will, how do we practically implement things? And that will involve talking to young people, sort of key stakeholders really around schools, for instance, but also it requires political will, and it requires a lot of people working together across this full spectrum, in multiple kind of domains and systems. And I think it's a very complicated thing to try and address, but it's something that we are really keen to try and do, and have put together partnerships to enable us to do this. I think this is the implementation science, and we're very keen to, I guess, use that implementation science to try and make a difference to young people, but it will be fundamentally about partnerships.
Yes, I'm glad you gave that answer, Fran, and I agree with it wholeheartedly. And I think the partnership that we have here, with embodied by Lynne being with us today, but with the Welsh Government, is really important in getting that practical pull through to make a difference for people going forward. So I have another question here, and I'm going to direct it to Stephan. This is about, you know, it's great to do research into, to paraphrase this question, it's great to do research into new interventions, but it's difficult to have the services to actually deliver them. So what routes can you see to ease that, or to develop interventions that can be direct to people and don't require complicated service structures to enable them to be delivered?
Again, I think sort of going back to Fran's answer and what Anita talked about as well, is making sure that we work in partnership as a research centre with those who can implement the fruits of that new scientific understanding. And I think that needs to happen at a number of different levels, whether that be at a whole country policy level, through schools, for example, through community services, but also through clinical services. And I think really key to that is having good relationships all the way through, and not thinking of the science and the research as being just unidirectional. We do the research, we provide answers supposedly to others, but actually to work together right from the beginning to frame the science in ways that is helpful in terms of its implementation.
And do you think there's a role for kind of modern technology? We heard mention of Mood Hub earlier and the like, for getting, you know, support and intervention to a wider range of people than can readily access our available services, even though we heard from Lynne about the extra support for them?
Absolutely, I think I think there's a real potential for technology to help us. I think also working at scale with young people across the country and those who work with them, for example, through the Schools Health Research Network, which already has strong partnership links, not just in terms of research, but actually in terms of understanding and conversations around mental health and wellbeing with schools across the country. And I think drawing on that is really quite critical.
Yes, sorry, Lynne, did you want to comment further on that? I know that, you know, for you, the link to the schools health research and the opportunity that provides in Wales is really important in terms of getting a detailed understanding of mental health in young people.
Yes, absolutely. I mean, the work of Sean is absolutely crucial, and I think we're really well placed in Wales because we've got that infrastructure there, and we're looking at sort of expanding that into primary schools as well. But I think in general terms, our whole school approach to mental health provides enormous opportunities really to reach young people really early on, and that's why it's such a central tenet really of our policy development. And we've got all the building blocks there now. It's about implementation, and the work that you are doing I think will play a really important role in making sure that we know that it's being implemented across Wales.
Yeah, it's great to see how the jigsaw kind of fits together, doesn't it, for this kind of here in Wales. So that's really fantastic. Okay, well, I'm aware of the time. People have been very patient, but I think that we have just a couple more things to do. So Bex is going to fire up the technology. Well, we thank Anita again, of course, for her excellent talk and all the panel for their responses. Bex is going to fire up the technology again, I believe, with a couple of final Mentimeter questions. We love Mentimeter. And then it'll just be the closing remarks. So thank you very much, Bex, and thank you, everybody.
Thanks, Jeremy. Okay, as Jeremy said, everyone, just two final questions from me before we finish today. So if everyone could head to menti.com and use the same code as we used earlier, which is 9649839. The link and the code will be going in the chat again, just so you can, for ease of access. I'll give everyone a few moments just to get to this stage, and then I'll put my final two questions to you. Great, everyone, people are answering already, fantastic. So yeah, my question to the audience before we finish is, what is the main thing you'll take away from today's webinar? Great, having a few answers appearing. Thank you, everyone. So you can see new knowledge about the Wolfson Centre, the importance of including young people at the heart of the research that we're going to be doing.
Just to say, Anita is in real time answering some people's questions in the chat as well. So,
oh, fantastic.
That's her direct dialogue here. Yeah.
Oh, that's really helpful. Thank you everyone for that. I'll move on to my final question because I'm conscious of time. So what part of the Wolfson Centre's future work excites you the most? So again, give everyone just a few moments to think of their responses, so there may be some overlap with their previous answers there.
Yeah, it's a great first comment there. Somebody's come straight in with a direct link between research and policy, and I'd agree that's such an exciting opportunity. Also involving people in research and translating to real outcomes. So yeah, it's great that these things are striking a chord with people. So while this is scrolling up and we're just getting those answers in, I'll just mention that, we are very keen to continue to hear from people about what they would like in terms of interaction with the Wolfson Centre. It seems appropriate to talk about this while we're interacting. And so there will be a survey. I think Bex will share the link, and you can comment on both how today's gone and what things you'd like to see in the future. So that'll be coming. I expect Bex will post that for you in the chat. And please do be sure to follow the Wolfson Centre. Now, I say this with great confidence, but I'm useless at doing it myself, but on social media channels, which if they're not down, as they were yesterday, but normally they're very available. So at Wolfson Centre. Great. Well, while that's continuing to scroll through, I'd just like to thank everybody today for attending and for taking part in this celebration and launch. We'd of course like to thank the Wolfson Foundation again for their support, without which this enterprise, which we've heard about so excitingly today, wouldn't have been possible. I'd like to thank very much all the contributors today. I think it's been a really lucid, clear and interesting session. And I'd particularly like to thank Lynne for joining us from the Welsh Government and spending the whole time with us here, which is really greatly appreciated. And I think, again, I'd like to say shows the importance you attribute to this area. As I say, do feel free to contribute to the follow-up survey. The information's in the chat, and we'd love to hear from people and keep up this dialogue. And the sessions have been recorded and will be available on the Wolfson Centre YouTube channel. So thank you all again, and look forward to continuing to engage with you and seeing all the exciting developments in the centre. Thanks very much finally to Bex and Kat for all the IT. It's very stressful, so you did great. Thank you. Thank you very much, everybody. Goodbye. Diolch yn fawr.